Thank you for viewing our video abstract. My name is Maxwell Ho, and I'm the first author of this commentary paper, titled Impassive Dictating, a mnemonic acronym for systematically generating differential diagnoses. My co-authors and I are interested in the process of generating differential diagnoses. We noticed that one common schema is to use an acronym-based mnemonic, such as Vindicate or vitamins A, B, C, D, E, K, which abbreviates different pathophysiologies to consider in your differential. However, we thought that these mnemonics were limited and wanted to develop a more comprehensive and generally applicable mnemonic. The impassive in impassive dictating stands for immune reactions and dysregulation, metabolic, psychiatric, allergic, structural, social, infectious, vascular, and endocrine or exocrine causes of disease. Dictating stands for degenerative, iatrogenic, congenital, traumatic, autoimmune, toxic, idiopathic, neoplastic, and genetic causes of disease. In designing this mnemonic, we wanted to include additional pathophysiologies which we felt were underrepresented in other mnemonics, such as structural, social, genetic, and psychiatric causes of disease. We also wanted to make sure that each letter only stood for a single term. For example, the first A in impassive stands only for allergic. We informally validated this mnemonic by reviewing two reports of disease, which included 371 and 115 conditions respectively, ensuring that each disease in these lists corresponded to at least one pathophysiology in impassive dictating. Here's an example of how to use impassive dictating for the chief concern of fever. I'll just leave the slide here for your own reading. While we recognize that this mnemonic is quite lengthy, we suggest that the acronym can be written down beforehand to expedite use. You can also generate smaller mnemonics for clinical presentations you may encounter often. For example, MIST, standing for Metabolic, Infectious, Structural, and Toxic Causes of Altered Mental Status, is a common mnemonic which can be constructed from impassive dictating. We hope that you can use impassive dictating when you encounter complex patient presentations or teach students about differential diagnoses. Thank you.